James. Now, what we're going to look at today is to give you a little bit of a background of where we're coming from and where this research comes from and how we got around to doing it. We'll give you a little bit of a background of who the Gypsy, Roma and Traveller communities are, and also we'll give some details from the findings of our research on mental health inequalities experienced by those from the Gypsy, Roma and Traveller communities. We'll also have some time to do a Q&A session, and we'll cover some examples of good practice we've identified, and also we'll speak about some recommendations. Next slide, please. Now, we have done this work and this research because we really wanted to put together some information regarding mental health of those from Gypsy, Roma, Traveller communities to support professionals who work on mental health or in the mental health area and improve their engagement with those small communities and so on. The report today and the details included there have been designed for those who work on frontline, for team leaders, commissioners, policy leads, primary care providers, and also for those who work in the charity sector. Next slide, please, James. Now, who we are. First of all, my name is Mihai. I work at Roma Support Group since 2016, where I currently lead on the policy and campaigns work that the organization does. And this work was done in collaboration with our partners, Friends, Families and Travellers, who is an organization based in Brighton who works to end racism and discrimination against Gypsy, Roma and Traveller people, and also to protect the right to pursue a nomadic way of life. While our organization, Roma Support Group, is focusing on working with those from the Roma communities and is mainly an advice and support charity, our friends from Friends, Families and Travellers are working on behalf of all the communities or under the so-called Gypsy, Roma and Traveller umbrella. I'm inviting everyone to Google us and to have a look at our website to find out more about who we are. And the work which we're about to present today was done through the Health and Wellbeing Alliance, which is a partnership between voluntary sector and the health and care system. This is a program jointly managed by the Department for Health and Social Care, NHS England, and UK Health Security Agency. So for the purpose of this work, we had a really good opportunity and support from cross-government departments. Next slide, please. Now, we really wanted to do this work in order to help improve the knowledge of Gypsy, Roma and Traveller communities around accessing mental health services. We also looked at improving understanding of how to approach mental health within the Gypsy, Roma and Traveller communities from a healthcare perspective, and also to provide suggestions on how to ensure Gypsy, Roma and Traveller people are included in the planning and provision of mental health services. Next slide, please, James. Now, what we've done for this work to reach to where we are today, we've looked at what other research exists out there, and we've done an extensive literature review exercise, and we've also engaged with those from our communities through surveys and focus group meetings. And so that included quite a lot of engagement with those from the Gypsy, Roma and Traveller communities. And also we've included views and experiences shared by people from our own teams, as both of our organizations have quite an extensive experience working with those from the Gypsy, Roma and Traveller communities, and both of our organizations have done work for years focusing on aspects related to mental health experiences. Next slide, please, James. Now, Gypsy, Roma and Traveller, so-called umbrella, include a variety of communities. And we've mentioned here on this slide who are the communities included under the GRT umbrella. And you will see that it's not just Roma, Gypsy or Romani Gypsy and travelers. It also includes communities living on boats, the boaters, new travelers, traveling show people, and Irish traveler. So there is a huge diversity, a rich diversity under the so-called GRT umbrella. Now, while some of us are sharing some challenges and barriers around accessing services or are sharing some of the life experiences, we have in many other areas, things are very different for the communities that are included under the GRT umbrella. And if we go to the next slide, we'll do a little exercise to see what do you think, how much we know about those from the Roma, Gypsy and Traveller communities. I have to say that for the purpose of this report and this work, we mainly focused on those from the Roma communities, the Gypsy, the Romani Gypsy, and the Traveller, the Irish Traveller community. So not as much on those from the boaters communities, new travellers, and so on. So let's see, what do you think about this question? Roma, Gypsy, and Travelers share the same ethnic origin. Is this true or false? So pretty much everyone agrees that this is a false statement. So let's try and have a look at that. We'll dig a little bit into it and share some details on this. Now, the Roma community is originally from India, northern part of India, to be more precise. Now, I am personally from the Roma community myself, migrated to the UK from Romania. But I know that our ancestors migrated, originally started to travel from India. And I know that when we still used to be there, we were split into different groups and tribes of Roma, mostly according to what we were doing for work. So there were groups of tribes working with metal, others doing work with wood, others working with animals, and so on. My, for example, particular group is used to make bricks, the red bricks, which everyone can see out there today. But we stopped that mainly due to industrialization and the negative experience that we had during the communist regime in Eastern Europe. Now, why this is relevant, why this diversity within the Roma community is relevant, is because when we started traveling from there, because of the group or the tribes that existed at the time, and also because of a caste system similar to the Indian caste system, we spread quite a lot across the world. So different tribes, different groups took different paths towards finding another place to settle. And this migration happened over quite a few centuries, and therefore, we're known as being a nomadic group today. And we know that there are about 12 million of Roma all across the world. Today, about 6 million in the European Union only. And we know that today there are Roma living all across the world, on all continents and so on. So there is, as I said, a huge diversity there. If we can move to the next slide, please. Yeah. Now, in regards to the other communities included under the GRT umbrella, as I mentioned earlier, this includes Gypsy or Romani Gypsy, which are English Gypsies or Scottish Gypsies, Welsh Gypsies as well. It includes Irish Travellers, New Travellers, Boaters, Showmen, and Roma. Now, in regards specifically to those from the Gypsy or Romani Gypsy community, we have to say that we do share the same ethnic origin. So if we go back to the map, which we earlier shown, where we've explained how much people have spread across and so on, what we know today is that a group of those Roma who started migrating from India managed to arrive in England about 500 years ago. And when that group of Roma arrived in England at that time, locals believed that they are Egyptians, and they used the word Gypsy as a short for Egyptians. So kind of worldwide Roma and English or British Gypsies do share the same ethnic origin. Now, this is not the case for those for Irish travelers, for example, or showmen or new travelers and so on. We know that Irish travelers originally are from Ireland, where they traveled from towards England and the rest of the UK. We know that there was a kind of larger migration of that happening at the beginning of the 1900s. Now, new travelers do not share the same ethnic origin. They do share some sort of nomadic lifestyle and so on. And showmen are those people who are have the nomadic lifestyle due to the nature of the work and traveling around to organize shows and so on. So I hope that gives a little bit of clarity around the communities included under the GRT umbrella. Now, we know that the GRT acronyms presents pretty much the same issues as the use of BA-ME, because it fails to reflect the true diversity of the communities referenced. And often, unfortunately, we've seen professionals not being able to make the differences between the communities under the GRT umbrella, and therefore sometimes policies or projects or programs are developed, but they do not necessarily reach all the communities under this umbrella. Now, we know today in the UK, from the 2021 census, we know that there are at least 170,000 Gypsy, Roma and Traveller people, but the estimates by different professions, academics or charity organization take the number up to at least 300,000 Gypsy and Traveller people, and a similar number in relation to those from the Roma communities. Yes, the number included in the slide refers to the UK. So there is official data that comes out from the 2021 census, and people can check that up. But I like to say that's we think it's an underestimate, given that quite a few of those more people are reluctant to confirm their ethnic identity publicly, and also because the last census mostly happened online. Yeah. So again, any other questions? I'll welcome in the chat box. We'll take that later on during the Q&A session. If I'll have time, I can reply straight away. But if there are more questions, we can look at that during the chat during the Q&A session later on. Next, please. Now, Now, why we're talking about mental health and inequalities in the context of those more communities. Now, those from the Gypsy, Roma, and Traveller communities do kind of experience a lot of health inequalities, given the social kind of context that we live in today, and unfortunately the negative outcomes we have in different sort of areas of life, and that includes education, health, employment, and so on. Now, since the pandemic, we know that the NHS has developed the Core 20+5 approach, which is looking at requiring a sort of an accelerated improvement in regards to communities who experience health inequalities. And if we move on next slide, you'll see that the plus category is the one which is relevant to those more communities, because it includes ethnic minority communities, and it also includes health inclusion groups. And the health inclusion groups specifically mention those from the Gypsy, Roma, and Traveller communities. So there is a policy sort of thing, and specific plans and strategies that reflect the experiences and the needs that those smaller communities have. Next slide, please. Great. Now there are, as I mentioned, aspects from different areas of life which impact the health inequalities that Gypsy, Roma, and Traveller people experience, such as education, where we still see that young people from our communities are having the kind of lowest achievements, and there is a lot of data on this available on the DFE, the Department for Education website. We know that children from our communities experience highest rates of exclusion, including permanent exclusion as well. And this is also the case with the adults from our communities. So although the situation has improved a lot over the years, unfortunately, adults from our communities still carry the experience they had in their childhood, and that includes also, for example, higher levels of illiteracy, or functional illiteracy amongst adults, people from the GRT communities, higher levels of people with low education as well. And obviously that has a direct impact on the way we interact with health services, and so on. Employment is another important aspect, and again, there is data here included, which comes from the 2021 census. We know that most of the people from our communities are working self-employed, usually long hours, also usually in lower paid jobs, and that obviously has direct impact on our health, a direct impact on ability to engage with health services, and so on. Accommodation is another very relevant aspect as well, and here it's obviously relevant for those from the Gypsy and Traveller communities living, for example, on sites, maintaining a nomadic lifestyle, especially because quite a few of those from the Gypsy and Traveller communities do not have access to an adequate site, and they have to live roadside and so on, because of not having access to enough sites, or because of challenges that they face when they try to access facilities which would be kind of adequate for their lifestyle. This is also the case from the Roma community, and not only the Roma, because we know that majority of those from the Gypsy and Traveller community also live in bricks and mortar. Now, Roma, in their vast majority, they are settled today all across the world, and that includes the UK as well. And we know that majority also, as I mentioned, of those from the Gypsy and Traveller communities are in settled accommodation. But unfortunately, that still it's not very kind of up to the standards. We know that quite a lot of those from the Roma community share from the private renting sector, often from rogue landlords, without having access to kind of adequate and good standard accommodation. And this impacts directly on their health, but also impacts indirectly, as often those from the Gypsy, Roma and Traveller communities who live in bricks and mortars might have problems confirming officially that they do live there, so might have problems having documents, confirming an address, and so on. And this quite often prevents access to GP, for example, where we have seen through our research and work that quite a few of those small communities are refused GP registration because of not being able to prove address, for example, when that we know that it shouldn't be the case. When we move, if we move to the next slide, please, James. And now we'll look into some sort of details of our findings from the research we've done. And obviously from our past experience working in the mental health area, but also from the discussions that we had for the purpose of this specific research, we have seen that there is a sort of a stigma that those small communities have in relation to mental health services and mental health issues in general. People from our communities don't really speak about mental health and don't really seek support around this when needed. There are sort of negative connotations that people associate with the word itself, mental, or with mental health problems, and there are different ways that our people are referring to mental health. So we've seen, for example, those from the Gypsy and Traveller communities referring to mental health as, for example, bad nerves, or people saying nerves are playing up, to refer to a mental health sort of condition, or to something, or mental health experience that they're having. In a similar way, we've seen that those from the Roma communities using words like, I have a pain in my heart, or I have there is some like referring to it as having something heavy on their shoulders, and so on. So do not necessarily kind of using words, mental health words, or specific mental health conditions to refer to it. We've generally seen that there is quite little knowledge when looking at specific mental health conditions. So not a lot of knowledge there around the specific mental health conditions people might suffer. Next slide, please, James. Yeah, now we've looked, for example, at specifically at men from our communities, and those from the Gypsy and Traveller communities are seen to face some of the greatest challenges around mental health of all men and boys in the UK. And there is research available by the Friends, Families and Travellers if people would like to look further into this. Also, the report we are sharing today gives a little bit of greater extent into this. we know that again from the research we've looked at, the literature we've checked, and from our experiences, we know that the Gypsy and Traveller men, boys, are at high risk of experiencing poor mental health. There are high levels of stigma and gender expectations, which are making it difficult for Gypsy and Traveller men to speak about mental health and therefore to seek support. We're also seeing that young Gypsy and Traveller people often miss out on chances to learn about mental health, or to find out where support is available when experiencing poor mental health. And also quite a few of Gypsy and Traveller men experience bereavement and untreated trauma from grief. Next slide, please, James. Now, when looking specifically at those from the Roma communities, as I mentioned earlier, as for those from the Gypsy and Traveller communities, there is a cultural stigma attached to mental health for Roma as well. And as I said, we would generally not speak about mental health, in kind of discussions between sort of members of the communities. Also, Roma people have a limited vocabulary in the Romanes language, which is the language that Roma people speak, to talk about emotions and also to talk specifically about mental health. So there are not a lot of words out there in our own vocabulary to express things around mental health. Now, when we do talk about mental health, people talk about refer to mental health as speaking about life problems, speaking about sometimes about stress, and we've seen that in the past years, more and more of those from the Roma community are actually using the word stress. And also people are talking about difficulties sleeping. So that would be kind of what you would generally hear when someone would try to speak about, someone from the Roma communities would try to speak about mental health. But as I mentioned earlier, the word stress does come up quite a lot in the past few years, indicated that more and more people are aware of this and are aware that this is impacting and it's something connected with mental health. It is considered a taboo topic, and it is actually the greatest taboo compared with other health problems. And we don't, as I mentioned, we don't talk too much about it within the community. That's because of fears of being judged by others in the community, and also within groups which are very, very traditional and very much about to sort of cultural norms within the community. People might keep mental health sort of issues within the family unit to kind of if they have young people who are about to get married, and to prevent them from actually not being able to find a partner. Sometimes people will keep that into the family unit. Now, we've also seen that Roma people don't really talk about mental health because of fears of how professionals might react to that. Unfortunately, that's happening mostly because of the experiences that those from the Roma communities had in their country of origin. And we've seen that happening in Central and Eastern European countries, where Roma have been placed in institutions and discriminated against when they kind of experienced mental health conditions, or they reported that. So there is a fear around how services will react as well if people do report mental health conditions. Uh, Now, the research available, including this one and other reports which are available on our website, for example, confirm that there is a higher risk of being in poor mental health and suffering from stress, depression, and anxiety. And that's strongly connected with the levels of poverty, deprivation, and marginalization that Roma people suffer. Sorry. Next slide, please, James. Now, we've also looked a bit at boaters and their experience of mental health. As you may imagine, because these people are living on boats, they are required to continuously move, especially if they don't have a long-term home, meaning that there is a pressure for them to move quite often. And the same like Gypsy and Traveller people, some boaters also face the threat of eviction. And this obviously is causing a high risk of anxiety, depression levels for many, and challenges around registration, and having a consistency in accessing healthcare. We've heard from boaters that sometimes the location where they can um, um, stop and with their boat is not very kind of accessible and connected to where services or mental health services are. Sometimes there are problems with, for example, letters going out to them and so on. So there are some specific kind of challenges and concerns there. We know that some boaters, like in also in general, generally for those from the Gypsy Roma and Traveller communities, some boaters are kind of more independent and more able to navigate the system and so on. So what we're sharing out today does not necessarily applies to everyone, but what will apply to those who are more kind of marginalized, those who are more um, have more experience of kind of being treated negatively or not having a kind of a safety over their home, the location where they live, and so on. Next slide, please, James. Now, in regards to the young people, as I did mention earlier when we spoke about education, um, uh, we have seen that the young people from our communities have the worst educational attainment comparing to any other ethnic group. And as I said, as you know, situation did improve over the years in the UK and across Europe as well. Still, when comparing to other communities, those children from our community still have the kind of lowest achievements when in regards to education. Now, there is a kind of a clear link established between school exclusion and poor mental health. And we have, as I mentioned again earlier, we have seen that children from our communities are 4 to 5 times actually more likely to be excluded from school and also to be growing up in poverty, and 10 times more likely to have a mental health problem. We have seen, especially for children who access secondary school level, that's the moment, the critical moment when they are kind of started experiencing mental health sort of situation, because that's the moment when a lot of bullying is happening in schools in regards to children from our communities. Now we've seen nearly 9 out of 10 Gypsy and Roma and Traveller children and young people suffered racial abuse. with nearly 2/3 also being bullied or attacked. And this contributes to poor attendance, poor behavior, and high levels of exclusion. And there is a really good report on that done by the Anti-Bullying Alliance, who looks at the experiences that the young Gypsy Roma Traveller children have and why is that happening, and gives insights from young Gypsy Roma Traveller children themselves. We've seen that most schools do not really challenge racist bullying against those more communities. There is a lack of consistency on policy approach within schools for this purpose. And obviously, leaving school early, for example, means that pupils from our communities are less likely to learn about managing their mental health. If we move to the next slide, please. Now, there is very, very little data available on Gypsy and Roma and Traveller people who are in prisons, although we know that there are quite high levels of those from our communities in prisons for various reasons. There is very, very little data and insights into that. But what exists out there tells us that Gypsy Roma and Traveller prisoners have low expectations of rehabilitation and release support, and usually they are finding this to be insufficient and poor. Also, the low literacy that exists in the community impacts on such activities and limits the interaction between prisoners and mental health services. We know from our experience, but also from doing this work, part of this research, that prisoners from our communities were more likely to experience bullying and to report feeling unsafe comparing to other prisoners. And this is something which I have personally seen when I went in prisons and spoke to Roma prisoners specifically. Next slide, please, James. Now, again, there is very, very little out there available in regards to Gypsy Roma and Traveller people from within the LGBTQ plus community. Now, although the situation is changing and is improving in this particular area in the past year, we're still seeing that these Gypsy Roma and Traveller people from the LGBTQ plus community are not generally accepted within the communities. And unfortunately, because of the stereotypes, negative prejudice against our communities, these people are often also refused service by the specific LGBTQ plus organizations. And generally, many of those from our communities remain invisible in this space by concealing their sexual orientation or gender identity out of fear. Now, when we're looking at specific experience of discrimination, we're seeing that these people face, triple or even quadruple discrimination as Roma, then LGBTQ plus, then Roma from the LGBTQ plus community, plus exclusion from the sort of LGBTQ plus community. And on top of that, especially relevant for sort of Europe, Central and Eastern Europe countries where Roma live in ghettos. That's not as much the case in the UK. But generally, for this cohort of people, it's quite hard, as many of them are still not accepted by the community, and on top of that, they're facing challenges when looking for specific support from relevant organizations. Now there are, as I said, the situation has improved, and today there are specific organizations from within our own communities. We know there is a group called Traveller Pride in the UK who works in this area. So there are things which are happening, and the situation is improving, but still there is a lot of work to be done in this area. Next slide, please, James. Now, when we look at specific mental health conditions that we've identified, as I mentioned, throughout today, there is very, very little data available in this space. And we've mostly looked at internal or research work that we have previously done, but also we've looked at what statistics or other reports are out there available. And for example, we've seen that suicide is 6 times more likely to happen for Irish traveller women comparing to the general population, and 7 times more likely to happen for those from the Irish traveller background, especially men. We also have seen that suicide is believed to cause around 11% of all deaths within those from the Irish traveller background. So really kind of serious sort of situation there. Also, statistics reveal the highest rates of self-reported poor health in Gypsy and Traveller communities with insecure and poor living conditions. 39% of Gypsy and Traveller experiencing anxiety and depression, which most people were facing the threat of eviction or poor sight condition. So as I said, quite a lot of those from the Gypsy and Traveller communities still living nomadically do not have access to adequate living condition, meaning that there is not a lot of access to sort of authorized sites where people can stop, and therefore they kind of continuously face the threat of eviction and do not have access to necessary things such as water, electricity, and so on when they live roadside on unauthorized sites. Gypsy and Traveller people are 3 times more likely to experience anxiety and over twice as likely to experience depression. Next slide, please, James. When we look at those from the Roma community specifically, again, very, very little data out there, but there is something that we've been able to kind of analyze from our own mental health work at Roma Support Group. We are doing a mental health project for the past, I think, 13 years. So that includes quite a lot of work that we've done with Roma people in this space. So we've done an analysis of the data that we've kind of collected over the years, and we have seen, again, from the cohort we specifically worked within the project, we have seen that 55% of beneficiaries of our mental health project suffering from depression, 32% suffering from anxiety, and 23% suffering from schizophrenia or psychosis. And there is a comparison with the national sort of rate there. Now, I have to say there is no official kind of NHS data to reflect this out there. Also, there is very, very little research that, our sector, the GRT sort of sector, has done in that space to look at the specific conditions. But we've tried to pull this out to give you a kind of, an indication of the information we know and the experience we have in this space. Next slide, please, James. Now, again, looking at suicide rates, and again, there is a lot of work and very good work that friends, families, and travelers have done in this space, with research and reports a number of reports being published in the past few years to look at suicide. Why is that happening, and how much is that happening within the Gypsy and Traveller communities? And we have seen that the main factors which influences suicide within the Gypsy and Traveller communities include being an unpaid carer, and we have seen that this makes it twice as likely for those from the Gypsy and Traveller background to commit suicide comparing to the national average. And actually, Gypsy and Traveller people provide more unpaid care than any other ethnic group within the UK, and have the highest proportion of carers providing more than 50 hours of unpaid care every week. There are high levels of self-employment within the Gypsy and Traveller communities. As I mentioned earlier on, that's the case for the Roma as well. But this also is a risk factor increasing the levels of suicide because of insecurity of work, because of the levels, the low paid sort of jobs that people from the Gypsy and Traveller background are doing, and the job security is another very important factor which is influencing the increased level of suicides amongst the Gypsy and Traveller people. Next slide, please, James. Yeah, as I said, you're more than welcome, looking at suicide to check the Friends, Families, and Traveller reports on this. Now, when looking at perinatal mental health, we've seen that women from the Gypsy, Roma, and Traveller communities are 20 times more likely to experience the death of a child as a mother when compared to the wider population. Many Gypsy and Traveller experience bereavement and unresolved trauma from grief, which obviously can have long-term health implications, which include depression, anxiety, and increased risk of behavior such as drinking alcohol or using or substance misuse. We have seen, according to a study mentioned here on the slide, 6% of Gypsy, Roma, and Traveller women experience death of a child, excluding miscarriage, and that obviously contributes to higher levels of depression. Also, from the experience and from the discussions we had with those from our communities, reporting that medical staff is more likely to offer antidepressants to those from our communities rather than counseling services. And also, there is very little awareness of postpartum depression within those more communities. And although kind of, we have seen the levels of knowledge of what can happen after the birth increased in the past years, still there is little awareness on it, and the way that people refer to it is different. So some people may refer to that as bad nerves. Others might use words as the baby blues. Others might say afterbirth stress, uh, especially those from the Roma communities. So there is some knowledge that this may happen, but nothing really like specific. Yeah. So generally, those Roma communities will not have kind of in-depth knowledge on this or and so on. Next slide, please, James. Now, specifically for the Roma, in relation to perinatal mental health, which we considered is worth mentioning, is the sort of culturally thing known as the purity period. Now, for those Roma who are still maintain a very sort of cultural lifestyle, and they very much abide to that, Roma mothers are considered unclean for the sort of a period immediate after birth, and that can be for like a couple of weeks or up to 6 weeks, in or more in some cases. Again, I'm reminding people here that there is a huge diversity within the Roma community itself, with Roma from different countries, from different groups of tribes, and so on. And what is happening in this case is that the Roma mother in such a situation will be expected to sit indoors and withdraw from kind of domestic sort of work. So she will not go outside the house, she will not cook, clean, and so on for that specific period of time. And she will have other kind of female family members joining and supporting with that. This is kind of considered to be something like good for the mother because she's given time to bond with the child and so on. And this obviously might impact on engagement with services, on ability of that specific mother to report mental health or to report things that are happening to services and so on. But it also may impact on attending appointments and so on. So that's something worth knowing. Now, I also have to add to this again that this is not something that applies to everyone. Some Roma might be more modern, other might be more traditional and so on. Now, from my personal experience, this was very much the norm. Something like 25 years ago. Yeah, and it was clearly expected that a mother has to stay indoors for that specific period of time, and she would be considered a bad mother if she goes out of the house with her baby immediately after the birth. But that's at least in my case, in my community, it's no longer the case. It's completely changed. So it's worth knowing this. Now we know Roma women are are aware that they may develop postnatal depression, although they might not refer to it as such, but they might be aware that it may happen that they will have depression after birth or something like this. But there is no common sort of practice to seek help for it. And we've seen that some Roma women will refer to it as being worried, not being able to sleep, or as I mentioned at the beginning, having a pain in the heart. And again, as I mentioned, those from the less traditional groups, or maybe young Roma who grew up in the UK, went through the education system in the UK, have a better understanding of this, but still, because of kind of the lower education achievement comparing to other communities, they might still have issues recognizing specific mental health conditions. Next slide, please. Yeah. Now, there are various barriers to mental health services, and we've named a few here. And I think I've touched on this throughout the presentation. So I'm not going to go into kind of a lot of detail on this, but there are administrative barriers, and especially the lack of cultural awareness within services, which makes the interaction with those small communities sometimes kind of not very sort of culturally appropriate, and therefore impacting on the way services engage with those small communities. The sort of the social context barrier, especially having no fixed address, and the literacy issue, language barriers, especially from those from the Roma communities who not necessarily speak English, digital exclusion, immigration status, again, for those from the Roma communities might impact ability to engage with services. And also lack of historical perspective and that experience that especially elderlies from our communities had in relation to health services impact as well, as we kind of grow up with our parents or grandparents, sometimes sharing sort of the trauma or the negative experiences that elderlies had in relation to health services, and including mental health services as well. Next slide, please, James. Yeah, and this is a quote from someone from the community we've spoke with during this research. Next one, please, James. Now, as I mentioned at the beginning, we do want to share some good practice that we've came across while we were doing this work. And I think we have some colleagues here with us who will say a few words about that. So if we have Elise here from New Talking Therapies, I'd like to.
Yes, I'm here.
Hi.
Hello, thank you very much for having me. It's been really interesting to kind of I think we have actually had this training delivered at our New Talking Therapy service as well, and I know people have found it really helpful just to kind of get an understanding of the barriers and kind of thinking about how people might present with difficulties. So yeah, it's really educational and beneficial. Yeah, so I think Samina just wanted me to kind of explain a little bit about the collaboration that we've done, and with essentially doing some kind of community outreach workshops within the Roma support group based in Newham. So Samina actually, kind of reached out to me as part of the project around kind of encouraging people from the Roma community to overcome barriers to mental health support, and we worked together to implement some regular workshops which people who attend are supported by their Roma support group will be coming along to. And I guess it was a real, I suppose, quite a journey, because we had to tweak quite a lot of different things to make sure that they were going to be inclusive and engaging, and get people actually kind of coming along. I guess you've mentioned a few of the things already in terms of the barriers that we came across, which was, for example, languages. Not just that maybe a lot of people didn't speak English, but that there was actually multiple languages within the group of people who were attending the sessions. So we first of all tried to run the sessions with an interpreter, which was great for the people who spoke one language, but if there was people there who didn't speak that language, then it was quite difficult for us to try and do that all in one session. So what we then did is we luckily have a couple of therapists within our service, one who speaks Polish and one who speaks Romanian. So we were able to facilitate the workshops at the same time in separate rooms, one in Polish, one in Romanian, which really helps to kind of just engage people because they're not having to wait so long for things to be interpreted and things like that. And kind of being able to communicate things in their own language seems to have allowed people to open up quite a lot. And we were quite surprised with how, open, sometimes people were being about their difficulties. I guess the second sort of thing that we found was that, traditionally our workshops use a lot of psychological language. They're kind of really geared towards giving people quite a lot of information. And we found actually with these groups, probably just taking it back and kind of having much less structured approach and actually just focusing on talking about one topic, such as anxiety, for example, and just talking about how that affects people and giving people a bit of an understanding about it, rather than trying to give them lots of different bits of information was much more effective. So kind of trying to focus on one thing and do it well, rather than trying to kind of bombard people with a lot of information. So those were the two main things that we kind of tried to do in order to adapt. And I guess, the key thing for us is kind of, that learning around making sure that you are being flexible to the community you're trying to engage with. And I believe, I can't remember exactly, Samina, what the numbers were, but in the first session or so, I believe there was maybe 6 or 7 people who attended. And I think in some of the more recent sessions, we've had upwards of sort of 15, 20. So, I guess trying to deliver them consistently and kind of building that safe environment for people to come along and talk about their mental health difficulties has meant that people have, more people have come, they've spoken about it, and it has resulted in also people referring to the service for support as well. So that's really great for us in terms of kind of engaging the community that is, as you say, underrepresented. So that was just a bit of an overview of what we've done. I don't know if I've given too much or not enough detail there, but yeah.
Thanks very much there. So this is a very, very good example of collaboration and how an approach that services can use to start engaging with us our communities. Now, next we'll speak a little bit about the work that Samaritans have done in relation to developing specific resources from those more communities. And I hope we have Eva with us here to say a few words on that.
Hi, yes, thank you so much for having me. And so I'm Eva, I work at Samaritans, and I lead the Suicide Prevention Consortium, which is a collaboration of Samaritans, the National Suicide Prevention Alliance, Support After Suicide Partnership, and With You, which is a mental health, drug and alcohol support service provider. And together we're part of the Health and Wellbeing Alliance partnership that Roma Support Group and Friends, Family, Travellers are as well. And together our mission is really to see suicide prevention prioritised as an inequalities issue in England, and by utilising our members' expertise, but also amplifying the voices of people with lived experience of the issues that people are facing. And I think this project in particular was about really leaning on that amplifying voices of people from communities. So as Mihai has already shared, we know that there's a really high prevalence of suicide amongst Roma, Gypsy, Showman, New Travellers, and many other communities kind of within that we've been talking about today. And when we talk about that risk factor, I think it's really important to note that just being a member of a community doesn't in of itself increase your suicide risk, but actually it's those experiences, and I know Mihai was touched on that really well in terms of that those experiences of discrimination, stigma, isolation, exclusion. Those are the things that impact people to go on and take their own lives. And so we really wanted to explore suicide and stigma with people from these communities. and give them a platform to share what they thought was most important. Our work is all about influencing suicide prevention at a national level in England. So the purpose, what we did was we worked with the absolutely amazing people with Roma Support Group, Friends, Family, Travellers, and Showman's Mental Health Awareness Charity to connect us to people, to have conversations about the topic and hear what they thought was most important to share with policy decision makers. And yeah, so I sort of wanted to share sort of 4 things that I really took from that project and that I would absolutely recommend anyone working with Roma communities in particular, but also any of these communities, and bearing in mind the diversity therein, as Mihai's sort of alluded to. Firstly, is working with community-led organizations. We absolutely would not have been able to develop and deliver the project as well as we did without working with these community-led organizations who know the work and have already done a lot of work in this area and pointed me in the right direction at times and shared resources. And we, as an organization, also did some cultural competency training with Friends, Family, Travellers. So working with the community-led organizations was absolutely vital for us. The second one, particularly with Roma community, is translation. We absolutely wouldn't be able to amplify their voices if we didn't have that translation. And it's really important to note that, you know, Roma Support Group provided that for us, and Samin has now become the voice of our audio clips, which just meant we could really hear in people's own words what they thought was important to share, which is so important. And it's not just the conversations, it's the informed consent, it's the recruitment, it's the soft stuff around that, like feedback and making sure we can remunerate people. So just so grateful for that. The third thing was about space. So often we set up these projects and we invite people to come to us, but actually it was really important that we booked a space that was known to the community, that they knew how to get to. So it was me getting on a train and using Citymapper to find out where to go, but they were really comfortable and in that space and knew where they were going. And so and that really builds up that trust, and especially when we're talking about suicide, that psychological safety for people. And again, having the translator be someone that they knew already as well, I think it all builds up the space in which you have these conversations and the support that you're offering, and it applies to so many different situations. And then the fourth thing, which Elise also kind of touched on, is the ability to respond and adapt. So there's a couple of examples for us that really came up for us. The language, Samaritans, we talk about suicide quite openly, and we're quite used to using our language around that, but actually I came along with questions around suicide and quite quickly realized I needed to adapt and respond my language to that of the community members. So this is the first time I'd heard about a pain in the heart to describe suicidal thoughts and feelings, or we talked about dark thoughts or difficult thoughts. And actually my question changed from, you know, how do you support someone when they have a suicidal thoughts, to how do you support someone when you know they have dark thoughts? And that opened up a conversation that we could then explore in more detail. I think, yeah, adapting our language is so vital, and being sensitive to the language that people are using. And the other, my favorite adaptation, which absolutely didn't expect, but we really encourage when people work with us to bring along someone to support them or anything like that, especially when we're talking about this. So we had a Roma woman who we recruited, and her husband came along with her, which is absolutely fine, and we were kind of welcomed him into the space to sit and have the conversation. When we started having the conversation, though, it was really obvious that both the man and the woman had things to say, and so it turned into a bit of a four-way conversation if you include the translator in that as well. And actually, when it came through the lens of a translator, I couldn't tell what was particularly from the Roma woman or particularly from the Roma man. Actually, the project aim was to amplify the voices of people from the community, and both these people came and they were able to do that together in a conversation. And so at the end, we talked about it, and I offered how would they like to be referred to? Would they like to be referred to as a Roma couple? And they were really excited. They didn't know that was an option, and honestly, neither did I. But actually, adapting and responding to what they felt comfortable with meant that we could include their really, really valuable contributions, and Samina and I didn't have to go through and sort of cut up, okay, well, what came from one person or what came from the other, because that's not really what mattered. What mattered was making sure their voices were heard. So yeah, those were the 4 things for me that really stood out working on this project. So working with the community-led organizations, getting translation support, finding a space that worked for the community, and that ability to adapt and respond. And I can see that Samina's already shared all the links in the chat. So we now have a page on our website about Roma people and suicide. So I'm not going to share what they said. You can go and look and listen to those. And it was so important for us to be able to amplify their voices and highlight that with key people in the Department of Health and Social Care, because we shouldn't be talking about it. It should be the communities that are impacted by these issues that should be sharing what's important to them. And we also worked with other communities as well. So there's a blog on Showman, a blog on Gypsy people, and a blog on New Travellers. Again, not representative of all the communities, but those are the people that we worked with, and we used the language of the communities that they wanted. But yeah, that's the work that we did, and just so enjoyed working with Roma Support Group on the project.
Right, thanks. Thanks very much, Eva, for sharing this. And also for sharing sort of your feedback and experiences working with us and with Roma people. I have to say, having that kind of flexible approach and so on was also actually kind of helpful for us as well, because it's not an easy topic to discuss and approach, people from our own communities with. So having that flexibility made it possible for us as well. So thanks very much for that. Now we don't have a lot more time available, so I'll quickly move on to looking at some recommendations. James, if you can skip further to recommendations from community members, I think would be good. Now we have made a set of recommendations saying they are specific to team leads, commissioners, frontline workers, and so on. You will see details of that in the report. But I'd like to briefly touch on recommendations coming directly from people from our communities, which said that they would like professionals to know more about the culture and be able to challenge stereotyping, to make sure that services are more accessible, suggesting things like having a range of options from online to in person, having mobile therapists to easily access drop-in sessions, recommendations around having training, but also targeted mental health campaigns. So people wanted professionals to know more about who they are, wanted professionals to do more around challenging stereotypes regarding our communities, wanted to develop services which take into account sort of cultural background and so on. So having mobile sort of therapists and so on, engaging, recruiting people from our communities, and also do campaigns which are targeting us. If we can move on to the Q&A session and take a few questions. We might go over a bit by a few minutes if that's fine with everyone. So please, if you have any questions, come off mute, raise your hand. I'm not sure if my colleagues have monitored the questions in the chat box. Yeah.
Yes,
okay.
Sorry, Mihai. We have a question first question from Michelle Williams. How can we engage with there being no local organization working with the Gypsy, Roma and Traveller community? It's one of my bugbears in Staffordshire. So we've shared some links to the service directory that both Roma Support Group and Friends and Families Travelers have. So you'll see it in the chat. But yeah, I don't know if my colleagues wanted to add anything to that.
It is indeed a challenge. Our own sort of sector, charity sector, you know, the GRT sector is very limited, and there are not a lot of us out there. What I would say, and what I see working for our people, when there is no one out there who can help them interact with a service, I see that having someone very kind of, you know, positive, open, friendly, when they first time sort of interact, makes a huge difference. And also when you first sort of interact, maybe, you know, put your badge away, you know, doing that might help. Being very clear about who you are and why you are there for. So explaining people what you do, the service that you work for, and what do you want to do in very clear terms, and on language which is kind of accessible to those people. You know, I think these are all things which make it possible for that to happen. I went in communities where no one knew who I am, what I do, and so on. And initially people told me that, you know, things like, I like to beat people like you who just come here to, you know, like they come to the zoo, you know, to actually overcoming that, and being able to sit down with people and speak and chat and so on, by simply explaining your role very clearly. Who are you, why you're there for, what you want to do, you know, in a positive, friendly manner, and so on. That really helps. Other questions? Someone has their hand up, so please come off mute.
Yes, I don't know if it is my own hand. Thank you, Bika. My name is Ifani. I work with KCC as public health specialist, and one of my roles is coordinating the activities of the Gypsy, Roma and Traveller communities in Kent. And I coordinate the community of practice group that we've just found out. I'm keen to know what your coverage area is, and I'm also keen to see how we can collaborate, because the work you do is very important, and I find your research so key and so insightful. I've learned so much. Even with my experience working with the group, I've learned so much today. But I know there's a couple of other groups working in Kent. I don't know where your coverage is, and I know colleagues here might have their coverage, who also do some work around, you know, recovery, mental health support, and all. And it would be nice to see how we can open up a wider collaboration, not just in our regions or where we are, but across England, because we do know the members of the community move from time to time, so that this collaboration can help people to find help wherever they are, regardless of the location or who they are. So I find your, you know, research very rewarding and very insightful. Well done for the good work.
Thanks very much for your feedback. Now, Simina has shared a link to our page on our website with local kind of Roma services or other Gypsy and Traveller services as well. We know in Kent there is a group called Samfire doing a project in connection with Roma. You might be already connected with them. We can help you with that. We are based in London. Roma Support Group is in London. Friends, Families and Travellers are based in Brighton. Some of the work we do is local, other stuff is national, such as, for example, this one. Any other question? I don't know, maybe from the chat box.
Yes, we have quite a few questions in the chat. I'm not sure if we'll manage to cover everything. We have a question from, I think, Bryony Barbosa. I'm developing an information pack for Dudley for GRT. If I refer to mental health as being bad with nerves, will the community see this as us trying to use language that they are happier to use, or will they expect me to use the term mental health and find it weird if I try to use their words? Yeah, interesting question.
Yeah, I'm not sure if Michelle wants to come in. I think it's good kind of, I don't know, official sort of publication and so on to refer to it as mental health, maybe in your kind of closer interaction with people, you might want to show that you know the kind of language around it and so on, just to make it a more sort of relaxed context when you're having those discussions. And the same way, like Eva mentioned in her presentation, I think that sort of approach would be helpful.
Can I just say that it probably be fine to use both, because for some people that the terminology mental health would work, but bad nerves would work for others as well. And I feel like you need to reach everybody. So I feel like, yeah, using both would be all right to do that.
Yeah, absolutely. And sorry, also, working potentially in collaboration when you're putting the, materials together, maybe having it sense checked by, community members or organisations such as FFT or Roma Support Group, reaching out and just saying, we've got these materials ready. This is how we've worded it and everything. We just want, maybe some community members to cast their eyes over it and give some feedback. Maybe we can change some words or whatever it might be. So doing it, in collaboration with community members is something that would be recommended if possible. I know, everyone's stretched and resources are limited, but where possible.
Yeah, and if you're putting out like flyers, make sure that you're using the right colours to generate the people that you want. If you're putting out something online, make it really visually pleasing. Try and do it so that it's something that's going to stand out to people and they can hear what's going on and what you offer. There's so much to be said for today. I mean, this is a major problem in the community, and somebody saying about that they haven't got a GRT organisation in their area. We're just finding it more and more and more. We're stretching, the ones that are on the ground doing the work are stretching themselves far and wide to try and capture the net of all of these. And I'm the founder of the GRT Women's Health Group. And that's what we started in Surrey, and then realised that because we was online, we could actually stretch out further. So we've got women advocates within the group now. They're actually dealing with things in their own borough, but the women's group is more like a hub where people come initially. And we do have speakers that come in there. So if anybody from any mental health team wants to come and do a talk or anything like that, they'd be more than welcome to get in touch with me. I'll put email in the chat.
Thanks very much for offering it's very, I think it's a really good opportunity that Dee is opening here.
Can I just add something to that as well?
Oh.
I think it's what a great session this was. I've been working with GRT communities for the last decade nationally, but recently I changed jobs. Well, I say recently, but 18 months I've been doing this job. And part of this job was focused on public health and GRT communities. And we have a fantastic site in Sandwell, which lies in the borders of Sandwell and Bilston, which I have visited many times, and the GRT communities have welcomed me, they've spoken to me. But one of the barriers I face is when the gaps were identified, such as they spoke about high levels of suicide, they spoke about drugs, they spoke about things like that. And when I offered them services, and I was even willing to bring it to the site, but they kind of said, oh no, we don't want people to think we've got problems here. So, and I really, then after that, I just felt like I found it difficult to break through. So I gave them space, but I'm planning to go back in because we're doing a mental health consultation. But again, I don't want to hit that brick wall. And I was thinking, what am I doing wrong? Am I doing something wrong by saying that I can bring it to you because they're not comfortable to come out to the council house and to where we are providing those services? Am I doing something wrong? I was trying to figure it out.
Yeah, I think this very well may be in sort of fear that people have around what would then other services think of them if the word goes out that these people are having mental health problems and so on. People might fear of what other services might think, what other people in the region, in the sort of local area might think. So it may be a specific, I don't know, fear of social services, especially children's services, and so on. So I think it is a kind of sensitive area here, and you might want to, I don't know, speak if there is a local, and on that site, a leader or something, to try to unpick that and find an alternative way of doing that if it's needed.
Yeah, we have tried those options, but I was just wondering whether somebody else might be able to give insight. But thank you for that. Can I just add I think somebody from Dudley said they're creating a pack. I mean, if they're willing to share that so we all can contribute to it and also utilize it, that would be great. Rather than re-informing recreating things, if they're willing to, that'd be great.
Now, we will be following up with everyone and share these slides, including our email addresses and so on. If anyone here wants to share any resources with people who attended the meeting today, you're more than welcome to email us, and we'll make sure that those resources will be shared with everyone.
Yeah, sorry, Miha, just to echo what you just said there about especially mothers of young children who are experiencing issues with mental health and maybe having support offered and seemingly kind of rejecting it and leaving maybe some professionals feeling like, what am I doing wrong? But you're not doing anything wrong. I think wrong's that would be the wrong word to use. I think certainly with mental health and mothers of young children, as Miha just said, there is a real fear of overzealous social services involvement, as Mihai mentioned, and that fear, however unfounded, is often enough to stop mothers, especially mothers of younger children, from reaching out for support with mental health issues. The sort of ultimate fear being that if I go to the GP will tell social services will think that I can't look after my children, that I'm crazy, and the children will be removed from the family home, and that is a massive issue among the communities. And I think just being transparent, speaking people through the processes and being as open as possible, and I think going to site or going to people's houses, the probably preferred way of doing it would be to do it somewhere neutral. Maybe if you do have like a coffee morning somewhere away from whether it's a site or whether it's people living in brick and mortar accommodation. There are issues around shame and gossip among the communities, and as well as the issue around parents being worried that other services will be involved. People are also keen not to be the center of gossip, or for people in the communities to be discussing their health issues. So when it comes to health issues in general, and especially mental health, just exercising as much discretion and being as transparent as possible and reassuring, I suppose, obviously where you can, you can't give false promises, but being reassuring and explaining the process of that support, or even potentially signposting those individuals to support services where they can get support anonymously, where they don't maybe need to sort of declare exactly who they are and whatnot, but even talking therapies, etc., that they can do sort of on an anonymous level. But yeah, there is real issues around mothers reaching out for support and accepting support with mental health, and one of the main issues is that fear of social services involvement. So just to bear that in mind when dealing with those mothers of young children, and like I say, just being as transparent as possible and as reassuring as possible, given the circumstances, whatever the circumstances are you're faced with. I don't think it's wrong. I mean, the way you said what we're doing wrong, I think it's more about reframing how you do it, and maybe doing it from a different, you're doing the same thing but just doing it in a kind of different way. So I wouldn't beat yourself up about it, and I just would more try and sort of attack it from that approach, maybe.
Okay, thank you.
Thanks very much, James. I'm mindful that we're already 10 minutes over. I've seen another point in the chat on religion. Again, how this is a complex kind of situation. As you have, for example, for the Roma, you have Roma from various countries from Europe who are in the UK. Usually Roma will have the religion from the country of origin, being that Christian Orthodox or Catholics, and some, especially those from the Balkans, like countries like Bulgaria, some of them might also be Muslim, and that the same I assume will be with those from the Gypsy and Traveller community, mainly having the religion from the country of origin. Now, what we've seen specifically to the UK in relation to Roma, quite a few of us are moving to becoming Jehovah's Witness or Pentecostal. yeah, yeah, that's the sort of situation. I hope that answers the question. Usually people from our communities are quite religious, even if they don't practice it. But we are quite religious. If there is any other kind of really sort of important question, I can take it forward. I don't want to keep everyone for too long. I'm mindful of the time. So
yeah, I think there was one question from Kate in the chat around who's a social worker in a local authority in a town in the south of England. And Kate was wondering if there are any local authorities doing a great job anywhere that they could promote to the senior management. That might be a bit more difficult to answer, but I don't know if our colleagues have any.
So, sorry, Mary Frances Trust are doing a lot of work in the south of England, as well as Time for Change in Surrey, but also the advisory board for Mary Frances Trust. I've actually just taken a position there as well. So things are moving along.
Everyone, I hope you did have a chance to fill in the I hope you did have a chance to fill in the end survey while we were doing the Q&A session. I think that would kind of conclude today's meeting. I hope this was helpful for you. Please use the report. Please, use it for your own work, share it further, and so on. As we really want it to be as helpful as possible. There is a series of other resources we've done as part of this program, which include experience that we GRT people have in relation to social prescribing services, maternity services, including infant feeding. We also have a report on digital exclusion and digital use of primary care services. And this is all the resources are available on our website and also on FFD's website. Thanks very much, everyone.